Oh, Laura, you will want to put that link in the chat um, just before starting the webinar so everyone has it.
All right, good afternoon, everybody. On behalf of the New York State Independent Living Council, I'd like to welcome you to today's webinar, which is the first in our year-long series. My name is Laura Cardwell. I'm the Executive Director here at the New York State Independent Living Council, and for short, we are NYSILC. NYSILC is an independent, nonprofit statewide council for independent living. So statewide independent living councils are established under Title VII of the Rehabilitation Act of 1973. In other words, every state and territory in the United States is required by federal law to have a statewide independent living council. We are responsible for jointly developing, monitoring, and evaluating the 3-year statewide plan for independent living. Our council is disability-led, with 26 members who represent New York's many regions, cultures, and disabilities. Our mission is to increase the advocacy skills, leadership development, and empowerment of people with disabilities. So it makes sense that today we are partnering with the New York Association on Independent Living to discuss this year's disability rights budget priorities and the many ways that everyone here today can work together to fight for the rights of all New Yorkers with disabilities. Before we get started, I'd like to cover some basic housekeeping. This is a Zoom webinar, and there are nearly 100 people signed up to attend. For this reason, we ask that you use the Q&A section to ask questions. If you are using Zoom on a computer, the Q&A section appears at the bottom menu of the screen. There is a word bubble with a question mark, and you can type your questions there. Questions can be asked by your name, or you can also ask a question anonymously. We will address the questions in the order that they come in, and we might combine similar questions to save time. We have American Sign Language interpretation, which is available in the window on screen. Our ASL interpreter today is Brooke. Human captioning is also available. To view the full captioning script, please visit the link that will be placed in the chat. And now I would like to invite NYSILC's Public Policy Committee Chair, Keith, to introduce himself and tell you a little about NYSILC's Public Policy Committee.
Hello, thank you, Laura. Hello, everybody. Thanks for joining. My name's Keith Gerge. I live in Ulster County. I am a former systems advocate from the Resource Center for Accessible Living, one of a number of statewide systems advocates, and I currently serve as the chair of the NYSILC's Public Policy Committee. So I do come from an advocacy background. Our members bring concerns, whether it's about housing, transportation, election reform, employment, education, health, and mental health. And we make a priority list and we cover issues. So, right now it's budget season. So, we are looking at the health budget. There is home care wages. We cover a wide berth of topics. Our meetings are on the second Wednesday of every month at 2 p.m. So we welcome members of the public to join. We also welcome members of the public to join the council as well. But I will Oh, and I served as the systems advocate from 2011 to 2016, and then from 2019 to through 2024. So that's my background. And I'm going to hand it over to Lindsay Miller.
Hi, everyone. Thank you to Laura and the NYSILC team for having us here today. For those of you that don't know me, my name is Lindsay Miller. I'm the Executive Director of NYAIL, which is the New York Association on Independent Living. The focus of our webinar today is to give an overview of our 2026 budget priorities here in New York State. So let me just start by level setting and giving some background on who we are and how we work together with NYSILC. So the New York Association on Independent Living is the statewide not-for-profit membership association of independent living centers across New York State. Laura gave a little description of NYSILC, which is required in federal law that every state has an independent living council with an explicit mission to help develop, implement, and monitor the state plan for independent living. And not all states have an association. And we're very fortunate here in New York because of the number of independent living centers that we have and the work that we all do together, that we're able to have a very robust and active association that works very closely with NYSILC to kind of manage all things independent living and help oversee advocacy, operations, implementation of independent living funding, et cetera. So NYAIL's mission is to lead statewide independent living center efforts to eliminate physical and attitudinal barriers to all aspects of life and to fight for the civil rights and full independence of all people with disabilities. We have several activities that we do, which includes technical assistance to our member independent living centers, program administration. We manage several statewide grants in collaboration with our member independent living centers across New York State. General, visibility and education on the work that independent living centers do across the state. And then, of course, statewide advocacy, which is what we're going to focus on today. And NYAIL is comprised of, our board is made up of the executive directors of each of the independent living centers in New York State. And I always kind of make the joke that if you ask how many independent living centers there are, it depends on how you want to count them. When we start talking about independent living center funding, we'll talk about how there's 41 centers in New York State that receive state dollars. But in terms of NYAIL's composition, our board of directors is comprised of the executive directors of all of the corporate entity independent living centers. So that's 33. We can go to the next slide, Emily. So NYAIL advocacy is a big part of the work that we do. We provide statewide advocacy on behalf of our member independent living centers, as well as the people with disabilities that they serve. We have several public policy subcommittees that hone in on these specific subject areas. So election reform, employment, health, housing, transportation, and inclusive education is a committee we had in the past, and we are looking to reconvene and get more active in the education space as well. The one committee that kind of historically has sat with NYSILC and that we work closely with is emergency preparedness. So NYSILC has an emergency preparedness committee and kind of takes the lead in that area. One of the main activities that we do through the work of our public policy subcommittees and then the overarching public policy committee is we develop an annual disability priority agenda with both budget and legislative priorities. So we've included a link on the slides, and everyone will receive copies of our priority agenda as well as these slides, where you can get copies of the DPAs as well as some corresponding materials. Next slide, please. So me and my staff are going to kind of talk through what some of the overarching and big priorities are for this year's budget. We are focusing, for given where we are in the time of year, on budget priorities. This is the time in Albany when all of the focus in the Capitol and the legislature is on negotiating the state budget. The deadline is April 1st. The last couple of years, it hasn't been a timely budget. So we'll see when the budget actually gets wrapped up. But once budget is complete, then we kind of shift into more legislative priorities. So we're not going to spend time today providing great detail about our legislative priorities, but we're happy to do that at a later date. So I'm going to start with the obvious, which is advocating for independent living center funding. As I mentioned, there are 41 state-funded independent living centers across New York State. They are currently funded at $16.75 million. And in this year's executive budget, there was a proposed cut, which is a cut of $750,000, which is considered a legislative ad that we were able to get in the last two budgets. So going into this budget, we're obviously looking to restore that $750,000 so that the independent living centers don't face a funding cut. And then we're asking for an additional investment of $8.25 million, which would bring the total funding up to $25 million to adequately support the network. I always talk about sometimes when you look at that we're asking to go from $16.75 million to $25 million, it might seem like a really significant jump. But when you do the math and divide by 41 centers, it's really not significant. And it also doesn't take into account historically how underfunded we have been. Because independent living centers are located in the state education budget, they have not been privy to cost of living increases that many of our human service partner organizations have been getting, particularly in the last couple of years. There's been a big focus of the budget. In addition to that, just by nature of us being in the state education budget, we kind of get lost in the shuffle where the focus is obviously on funding schools and libraries. And so we are lucky if we, can get any attention or any funds left as part of that budget. So we have historically been underfunded. NYAIL recently commissioned a study that indicated that the base funding for an independent living center should be around $650,000. And that's just what's required to ensure that you have the staff necessary to provide the core required independent living services, as well as the operating expenses associated with that. So, paying rent, having a building, insurance, et cetera. The average independent living center currently is funded at around $350,000. So the $8.25 million would bring the total funding up to $25 million and would help ensure that all 41 independent living centers are getting to that base funding level needed and kind of help set us straight moving forward. So in addition to asking for that restoration and additional funding increase to the base independent living funding, we are looking to be included in the human services COLA moving forward so that we're not constantly trying to play catch up. So the legislation that's noted here, S3669, would add independent living centers as well as some other human service agencies that are located in state agency budgets outside of the traditional OMH, OPWDD that are currently not included in the annual human services cost of living adjustment. Next slide. The next big priority is the Consumer Directed Personal Assistance Program. I'm so sure that most of you on here have heard about this over the last couple of years because it has been a huge focus of the budget and on the advocacy of the Independent Living Network. The Independent Living Centers were instrumental in creating the CDPAP program decades ago here in New York State, and we had 11 Independent Living Centers who have administered the program as fiscal intermediaries for decades. In two budgets ago, I believe it was now, feels like forever ago, but also yesterday, the state, rather than kind of address some of the issues that had clearly occurred in the program since the introduction of managed care, which included exponential growth in the program and exponential growth in the number of agencies that were administering the program, rather than, directing the Department of Health to put on its regulatory hat and take control of the program, they decided to essentially shut down the program by transitioning all 600 fiscal intermediaries out of business and shifting the entire program to one statewide fiscal intermediary, PPL. It's been a very problematic process for a number of reasons. Obviously, from the NYAIL perspective, the independent living centers were cut out of the program that they helped create and that they were administering with integrity as a benefit to the people that they serve in the community. It's very mission focused to us. But it's also been very problematic for the consumers and the workers. The transition was very rocky. Even now that the transition is complete, PPL, there have been a number of issues in terms of paychecks not being processed timely or accurately, consumers not getting the support that they need, especially for the consumers that existed within the independent living center programs. It was more than just processing a paycheck. It was about really supporting people with disabilities and taking control of their own care and, learning how to be an employer and recruit your own workers, et cetera. And that support is really not there in this new model. The state is claiming that there's been $1.2 billion savings as a result of this transition, although I think we all question that, and there's certainly no data to back up that documented savings. And really, there's no data on the program at all at this point. So one of the things that we're pushing for at this point is to see transparency in CDPAP program moving forward. We link to the bill's S9142, which would require robust quarterly reporting from the state and PPL on CDPAP with, very basic data, like how many people are in the program, how many workers, who's being paid, and also some other more detailed reporting. The other piece that we're really working on more administratively, but there is a legislative approach too, which is preserving the role of independent living centers in CDPAP. The statute that shifted the state over to a statewide fiscal intermediary did require that ILCs be subcontractors of PPL. And while that has happened on paper in terms of us signing contracts with PPL, it certainly hasn't been playing out as intended. The independent living centers are not getting referrals from PPL, and PPL has a financial incentive to keep the majority of consumers for themselves. So people aren't being promoted the use of facilitators. So we're really pushing both legislatively and administratively with the Department of Health and the governor's office to ensure that the statutory intent is upheld and that independent living centers and the other facilitators are fully utilized and remain in a role in the program moving forward. Next slide. And then the last one I'm going to talk about is some of our priorities on supporting transition to community living. I think one of our overarching concerns of this year's state budget is that despite all of the threats of cuts at the federal level, there actually aren't many cuts proposed in this year's budget. There's actually some investment, except that and they're claiming that it's a result of the supposed savings from the CDPAP program. But the investments are going primarily to institutional settings, so nursing homes, hospitals, et cetera. And we're seeing little to no investment. In fact, we're seeing cuts to some of the programs that support people with disabilities living independently in the community. So in addition to kind of the general overarching advocacy point that we want to see more focus and investment on community-based services for people with disabilities, some of our specific asks are restoring access to the nursing home transition and diversion Medicaid waiver. This is a Medicaid waiver program that was also created by the independent living community, provides a unique set of services, including robust true service coordination, not like the care coordination that individuals receive through managed care plans, as well as oversight and supervision, which is essential for folks with dementia or cognitive disabilities. And it is essential, this program, to helping people with disabilities and older adults transition out of nursing homes or avoid unnecessary institutionalization. And similar to what we saw happen in CDPAP, since the introduction of managed care here in New York State, the program grew exponentially, primarily from managed care plans transitioning some of their high cost, consumers and individuals out of their program into the waiver to try to improve their bottom line. And the state, rather than taking regulatory action and addressing the issues that were impacting the waiver negatively, decided in last year's budget to shut down access to the waiver altogether. So there was an administrative cap put in place that actually just went into effect in January. So moving forward, no new individuals can be enrolled in the program. So we're really pushing that the state restore access to this program and work with advocates and the independent living community, the RRDCs who help administer the program on behalf of the Department of Health, to address the real issues impacting the program, primarily some of the actions of managed long-term care, and restore access to the program. Similarly, we want to see investment in the Open Doors program. Open Doors is a nursing home transition program It's funded by the Department of Health and administered by NYAIL. So NYAIL is the lead contractor with the Department of Health, and we subcontract out to our member independent living centers to staff transition specialists across the state that are actively going into nursing homes and helping individuals that have expressed an interest in returning to the community in making that transition happen. The program currently has 60 transition specialists funded across the state, and we're looking for an investment of $2.5 million, which would allow us to increase the staffing by 50%. So bring us up to 90 transition specialists statewide. The infrastructure is already in place. The program has proven to be successful. In 2025, we transitioned over 1,000 people in total, 667 of which were MFP qualified, meaning they went to an MFP qualified setting, and the state gets additional FMAP for them. So the infrastructure is in place. The program has proven to be successful, and a modest increase in funding would help us not only increase staffing, but as a result, increase transition. We think this is especially timely given the state is set to release a new Olmstead plan any day now. And absent any additional investments in community-based services in the state budget, at a minimum, the state should be investing in the programs that have proven to successfully support Olmstead goals in transitioning folks out of institutions and back into the community. So at this point, I am going to pass it to Jose Hernandez, who's on the NYAIL team, to talk about some of our additional priorities.
Thank you very much, Lindsay. My name is Jose Hernandez. I am the Advocacy and Policy Associate with the New York Association on Independent Living. The first thing I'm going to talk about here is repealing the cuts to the home care eligibility. In fiscal year 2020, 2021, the Medicaid redesign team 2 implemented the cuts to home care eligibility. Fortunately, they weren't implemented that year. They just happened to pass. However, as of last year, September of 25, those cuts went into effect, and anyone applying as of September need to demonstrate that they need assistance with at least 3 activities of daily living, which include hands-on, like dressing, bathing, toileting, transferring, turning and positioning. Whereas before 2020, you only needed to demonstrate that you needed at least one help with one activity of daily living. It also eliminates level 1 home care, which provides assistance with instrumental activities of daily living. That's cooking, cleaning, guidance, assistance to go to appointments and stuff like that, but that's no longer qualifications to get home care, with the only exceptions for people with dementia or Alzheimer's disease who need supervision, help, and at least 2 ADLs. This creates, 2-tier eligibility requirements where it should be based on diagnosis and ability instead of diagnosis. Sorry. So we are supporting bills A1198 by Poland and S358 by Rivera to repeal these eligibility cuts and restore to previous eligibility standards to prevent harm and people going into more costly institutions or hospitals to get the care that they need. Next slide. So, the Fair Pay for Home Care Act. New York currently has one of the worst home care worker shortage crises in the nation, and it's due to many factors, but one of the main contributing factors is the low wages and the increase of cost of living across the state. It also has become a lot more difficult to recruit since the transition to the one state FI. It's plagued with problems. I've been trying to recruit someone or get someone on the books since November, and you could only imagine how frustrating that can be. So Home care is the primary barrier for those who require home care to live in the community or transition out of a nursing home. The Fair Pay for Home Care Act will solve this by tying the home care workers' pay to inflation. Um, so if the cost of living goes up, their wages also go up. So everything in the city is a lot more expensive, in the state as well. So transportation, food, rent, utilities, everything is going up. So we need fair pay for home care to help not only the home care workers, but keep individuals with disabilities like myself living independent in the community, um, by paying our home care workers a living wage. Next slide. Finally, I'm going to talk about the Home Care Savings and Reinvestment Act. In 2011, New York transitions its Medicaid home care program to long-term managed care companies. Many of you might know them as MLTCs, claiming privatizing home care would improve care through care management. As someone who is in an MLTC, they really don't do much care management. To say they like to deny care and services, and you have to utilize the fair hearing process in order to get anything done. It's also very frustrating when you need appropriate home care hours and they deny. And as Lindsay said, if you're a high needs person or individual who needs high needs care or 24-hour or 12-hour home care, they try to transition you over into the NHD waiver, creating the problem that we're in now. Managed long-term care companies routinely collect billions of dollars annually to provide care management, and they really don't do that. And I already spoke about the cutting of the hours, equipment, and failing under the care management. I literally saw someone for 5 minutes and they call that care management. So the Home Care Savings and Reinvestment Act will return home care to a fee-for-service, conflict-free system that prioritizes consumers, providers, and home care workers. This approach would save New York millions of dollars that would be reinvested into the long-term care system to ensure adequate hours of care and fair wages for home care workers. Everything I spoke about has to do with home care and being able to live independently in the community. And it seems every year we have to bring up a new priority because home care is always under attack somehow. But I am going to hand it over to Elizabeth.
Hi everyone, next slide, thank you. Hi everyone, my name is Elizabeth McCormick. I am the Director of Advocacy for the New York Association on Independent Living. One of our next priorities in our disability priority agenda would be requiring managed care organizations to reimburse providers of durable medical equipment, or DME, at the same rate as Medicaid fee-for-service. So managed care organizations currently reimburse at less than the Medicaid fee-for-service rate, and they charge administrative fees, and this has put a big burden on smaller providers. 19% of providers have left the market over the past 10 years, but Medicaid enrollment has grown by 48%. So that really impacts the availability and access to durable medical equipment when there are less providers but more people. And getting parity in reimbursement rates, which means the same reimbursement rates, would help smaller independent DME providers that are in communities and may know you better, rather than large big companies who may not be local and won't know your needs as well. Next slide. One of the next areas for our priorities is transportation priorities. One of the things we're advocating for is a paratransit expansion. Paratransit is transportation for people with disabilities that operates within 3/4 of a mile of a regular bus line. This is a very small area for paratransit, And these minimums have not been updated since paratransit was created with the ADA and the Americans with Disabilities Act in the 1990s. So this was always meant to be the floor for access and not the ceiling. And when we are seeing regular bus routes be cut or eliminated, disabled people are then left stranded where they are, which can impact employment, health, and their community involvement. And a lot of these things can be addressed by expanding paratransit to be in a larger service area and be able to serve more people to get the transportation they need. And our budget ask is for 25 million for 5 upstate transit authorities for a pilot program to expand paratransit. Where we got the $25 million number is that the Niagara Frontier Transit Authority in Western New York put out a report on expanding paratransit that supported $5 million for each of the 5 upstate transit authorities. So that's what we're advocating for, and this will really help people be able to get where they need to go and not worry about where they're currently living be cut off from paratransit just because they change where the bus line goes. Thank you. I'm gonna hand it over to Blaze.
Let's see. Okay. Emily, do we have the access to home slide up on the screen?
Yes, we do.
Okay, thank you very much. I had to ask that because I am too blind to see the screen. So good afternoon. Thank you for being here with us. I am Blaze Bryant, the communications specialist here with the New York Association on Independent Living, or NYAIL, as I'm going to talk about the Access to Home program, which is administered by the Homes and Community Renewal. This program allows people with disabilities to make home modifications to make their place more accessible. Things such as ramps, widening doorways, accessible showers, accessible toilets, grab bars. Those are just a few examples of home modifications. Now, how the program works is nonprofits are able to apply for the funding to in turn help their consumers. We actually have a couple of independent living centers who administer the Access to Home program. I see we have some representation from the Resource Center for Independent Living in Utica, RCIL. So great to see you, as well as our Rockland Independent Living Center, Bridges. Both of them administer the Access to Home program. Now to the budgetary stuff. Until the past couple of years, Access to Home was funded at $1 million for better than a decade. The way the program works for people wanting home modifications is the program covers up to $25,000 in home modifications. So, though I have a communications degree in journalism, this is math even I can do. If 40 homes, that's 40 homes, need the maximum amount for home modifications, that $1 million disappears. There are 62 counties in New York State. That means literally not every county is able to be served by the program. The $1 million is what is proposed in the governor's budget for this year. The chat distracted me a little bit with the screen reader. So the ask here is twofold. Number one, to, at minimum, get the legislature and the governor to bring it up to $5 million, which is where the funding is at currently. And then number two, increase it by an additional $5 million. So the total programmatic funding is at $10 million. This means we actually can serve 400 homes throughout the state for home modifications to really begin addressing the disability housing crisis. It frankly makes no sense to me how we're cutting back investments in home and community-based services and accessible housing when we have an impending Olmstead plan coming out, which, if you're not familiar with what Olmstead is, the short and sweet of it is it was a Supreme Court case from 1999. Two women from Georgia, they sued the Supreme Court because they had been institutionalized, and they were claiming, rightly so, they belong in the community. They were successful in doing so. So Olmstead is community integration at its core. Also, it's quite ironic that we have a master plan on aging that came out, I believe it was last year, and this is what's happening. So it really is antithetical to what our reality is. Budgets are moral documents, and this tells you everything you need to know about how the governor is prioritizing our rights as people with disabilities. So let's head on to the next slide there. Let me know when we have that up, Emily.
It's up.
Okay, thank you much. How can you get involved? Well, there are a few things you can do. Get in touch with your assembly members and senators. The links on the slide will take you right to, or should take you right where you can look up who your assembly member or senator is if you do not know who they are. You can also join one of our NYAIL public policy committees. So if you have particular interests in health, employment, election reform, which is a fancy way of saying voting, transportation, housing, and want to be a part of restarting our inclusive education committee, fill out that form. That goes straight to our director of advocacy, Elizabeth McCormick, who you heard from a few minutes ago, and she'll be in touch with you. The last thing that you can do is sign up for our action alerts, which over the next few weeks will be coming fast and furious, as in a couple of weeks, the Assembly and Senate will have, or should have, their one house budgets out, which then means at that point it's a negotiation between what the governor has already laid out in her proposed budget, which is what we've been talking about for the past half hour or so, along with what the Assembly and Senate have in their respective budgets. That's how the final budget is determined. You play a critical role in this. If we all do whatever it is that we are able to do collectively, we can make this a better state budget overall for the rights of people with disabilities. So at this time, I think we're going to take the slides down, and you can put your questions in the Q&A box there on the screen, and any of us are happy to answer your questions. So thank you so much for being here. I believe I'm turning it over to you, Emily, for the Q&A, or is that going to be you, Laura? Well, whomever, you're up.
Hi, Blaze. This is Laura. So I can start going through the Q&A. We've had a couple of questions come in. The first question, I believe this would be most appropriate for a member of the NYAIL team. What can a transition specialist do to help me get out of a nursing home? And where and how would the proposed additional funding be used?
I can take that one. So the transition specialist is really a problem solver. It depends on what the needs are, and we will help address them. So, a transition specialist will come in and meet with any individual that's in a nursing home that's interested in transitioning out and find out what the issue is that's preventing that transition from happening. So, do you have housing lined up? If not, you need housing. Can you afford housing? Do you need accessible housing? Do you need home care? We have a discharge checklist that will kind of go through, and either we'll be the ones managing what's on that discharge list, or we'll be making sure that someone is taking care of it, whether it's the nursing home discharge planner, the managed care plan, et cetera, and basically help make sure all the pieces are in place for you to transition back to the community. We always say that no two transitions look the same because it's all based on the individual's needs, and what needs to happen in order to make that transition be successful. The additional funding that we're requesting, and this request came out of the MISC, which is the Most Integrated Setting Coordinating Council, which is the body that's in charge of helping oversee and guide the development and implementation of an Olmsted plan and Olmsted goals in New York. The MISC had a subcommittee on deinstitutionalization, and this was their recommendation to kind of increase the infrastructure and staffing that's available on the ground to help make transition and, in turn, Olmsted goals a reality. So the additional funds would really go to adding more transition specialists across the state so that we can go into more nursing homes and help make more transitions happen throughout the year.
Thank you, Lindsay. And I'm just going to be putting a link to the transition assistance page on NYAIL's website in the chat so that everyone here can access more information about that program. And I see another question has come in, and this person, I think this was partially answered by Blaze, but this person wanted to know, how can I best help support these bills? So are there any areas where you feel that there are certain strategies or certain types of advocacy that you're currently missing that you need more of? Like, for example, are you looking for people to, send in written communications like testimony, letters to the editor? Do you find committee participation is lacking in any specific issue areas? I just love to know some more details about this.
Sure, I'll take it. This is Blaze. So I love this question because there are so many things you can do. Certainly getting in touch with your legislators is important because at the end of the day, whether you voted for them or not, they represent you. It's especially critical in an election year. Everyone, all 150 members of the Assembly, 63 members of the Senate, and the governor are up for re-election. This happens once every 4 years. So this is a really pivotal point to really make your voice heard. You can call them, email them, set up meetings with them in their district offices. There is a legislative calendar that can be handy to go by, although because of the weather, that's going to change a bit. So your best bet is to get in touch with the assembly members or senators and set up meetings there. Letters to the editor to your local newspaper are critically important. Also, if you have social media, sharing your story is extremely critical, and tagging and tagging your legislators. That's another really good one because it does two things. It puts the issues on their radar, and you're also doing public awareness, which is so the public awareness part of this especially is critically important because when the public sees how historically bad we've been treated by um, by governmental administrations, it it really makes them think and react in ways that they otherwise wouldn't. So I know that's a very long, multi-pronged answer to your question, but it really is doing whatever you are able to do um,
Yeah. And
to
I
advance
just
our
want
priorities. Scott,
to
Lindsay,
jump in
sorry.
and say, join NYAIL's action alert list, which I believe was linked on the slides. And if not, we can be sure to get it out because we'll be tracking over the next couple of weeks kind of the budget process and having targeted alerts based on where things are moving and where we need folks to weigh in. So for example, we're going to be asking folks to write to their legislators specifically about the importance of independent living funding. So that action alert will be coming out soon. And and then I think in terms of Laura, you asked, whether there are certain committees where we need more support. I did mention that we're looking to reconvene our inclusive education committee. So if there's anyone with interest in education, special education, early intervention, or expertise. I know there's a lot of staff throughout the network at centers that do this type of work. We're really looking to recruit committee members for that new committee. So
This is
I
Jose.
also wanted to, sorry, Jose. I also wanted to add that you can get involved with your local independent living center on their advocacy efforts, but there's also something called the Statewide Systems Advocacy Network, and 14 centers are a part of that specific network, and they have staff who are specifically designated to do systems advocacy. So, for example, at our budget advocacy day earlier in February, a lot of the systems advocates that are part of the SAN coordinated a group of volunteers to come up to Albany and share their story and advocate with their legislators. So that is something you could do if you are interested. I don't have a list of the SAN centers. It's SSAN is the acronym. I don't have a list right now, but if you reach out to me, I could give you more information on that as well, in addition to the education committee. Jose?
I just wanted to say that I linked, but Laura did it much better than I did. The link to the action alerts, and if you're listening to us and have a minute or two, click on it, sign up, and you will get the action alerts as soon as we put them out there.
Yeah, I mean, Blaze here. I mean, I know we're sounding like we're doing fundraising for PBS or public broadcasting, but it really is doing whatever you are able to do. The Statewide Systems Advocacy Network, it is very hyper local advocacy. I mean, I know there was a lot of discussion about addressing snow removal, which I mean that continues to be just such an issue that we're all dealing with here in the state. So it really is doing whatever you are able to do. You don't need to wear Superman's cape, or you don't need to feel like you have to be this superhero. Collectively, we will win.
Thank you, Blaze. And so I just had another thought come up that I wanted to ask, and I know that many of the people here attended Budget Advocacy Day in Albany on February 9th, and I was wondering if there are any other in-person or virtual events lined up on the calendar that we should be saving for the future, or if that may be dependent on the timing of the one house budgets and other things, but I just wanted to see if there was any information about future events.
Well, I mean, the short answer to that is sign up for our action alerts.
Good answer.
uh,
Good answer.
be, I'd be doing my job a huge disservice if I didn't plug that for the 12th time, because that's where we're going to be sharing we'll be letting folks know about advocacy opportunities, because the one house budgets, if you're not familiar, those will come out from the Assembly and Senate generally end of the first week of March, early part of the second week of March. So that leaves us, if the budget is on time, which there's no guarantee, about 3 weeks to really be hammering home our priorities.
Thank you. So just based off of an earlier conversation that we were having, I'm going to drop a link in the chat with information about the Statewide Systems Advocacy Network, the SAN, for your information. So I'm announcing that also because if anyone is listening using a screen reader and suddenly a link comes in, I just want to provide some context as to what's being put in the chat. So are there any more questions that anyone attending has about anything that was discussed on the webinar today, about future advocacy? I'm happy to field general questions about NYSILC as well. Okay, well, if not, I just wanted to say that we greatly appreciate you coming today to learn about this year's disability rights budget priorities. I wanted to especially thank Lindsay, Liz, Jose, and Blaze for your leadership and advocacy, and for taking the time to speak to our audience today. We will be providing a copy of the slide deck to everybody who registered today. And the recording of this webinar will be uploaded to NYSILC's social media channels. So for our next webinar in the series, please join us on March 25th at 1 o'clock. The next webinar in the series will be featuring Nicole Russell, who is the founder and executive director of Autistic Adults New York City. And we'll be having a discussion on independent living skills for autistic adults in New York, as well as a conversation about what barriers exist that make independent living difficult for autistic people throughout the state. So this webinar is open to anyone that has an interest in the subject matter. It is not limited to autistic adults. And I will provide a link to register for that webinar in the chat. So I also want to acknowledge and appreciate my staff, Emily Bianchine Cummings and Amy Wink, for putting together all the work that comes into coordinating this series. So just wanted to express my appreciation there. But I wish everyone a wonderful rest of your day, and we hope to see you at the next event.
Thank you, NYSILC, for having us.
Thanks so much. It's been a pleasure.
Take care.
Thank you.
Bye.